Hello, this is Dr. Gay from First Sick MRI, and this is a 29-year-old male with complaints of knee swelling anteriorly for many years, about 7 years. He had a diagnosis of prepatellar bursitis, and he's had an acute flare-up here and wanted to get another view of this. And on this view, we see the kneecap towards the left here. Here's the kneecap here. This view on the left is called a T1 weighted image, where fluid is dark and marrow is bright, so the femur, the tibia, and kneecap are bright because they have fatty marrow and there's subcutaneous fat that's bright. On this view, this is a fat suppressed sequence where marrow is darker and fluid is white. So we see the problem is this fluid in the front of the knee, and it does correlate with his history of swelling around the kneecap. But we can see that this is not in front of the kneecap. Prepatellar bursitis is localized to the front of the kneecap. It's not behind it or below it. And instead we see the prepatellar soft tissues. We have a little bit of edema, a little bit of brightness along this band, but really there's no big fluid collection in the front. The problem is below the kneecap in a little fat pad here called Hoffa's fat pad. This is Hoffa's fat pad here I'm outlining, so we have a regular fluid signal intensity structure in Hoffa's fat pad. And again, it's not prepatellar bursitis like is thought for the past 7 years. So we're going to put up another view in a different plane, the axial plane, where we can see the kneecap here in the front, the femur behind. This is the lateral side. And as we go down, we see this fluid collection that's in Hoffa's fat pad, which is beneath the kneecap, in front of the femur, and it also protrudes out here laterally between the patellar tendon and this lateral retinaculum. So this is not a prepatellar bursitis. It is a complex cystic lesion, and the two things we think of when we see a cystic lesion like this are, number one, a ganglion cyst, and number two, a synovial cyst. Sometimes in younger patients, if we have a complex cyst, you can have neoplasm that can look or mimic a cyst, but this patient has had this for 7 years, so this is probably just a benign cyst, like a ganglion cyst or a synovial cyst. So he's going to take this back to the orthopedic surgeon and get some treatment advice. Thank you very much.